Hi everyone, we are the Blue Group and this is our strength, weaknesses, opportunities, and challenges, or our SWOC analysis, and we're reviewing the CRNA's role in the VA system. In this group include Erick, Sarah, Hana, and myself, Jessica.
There are a number of strengths to this plan. By enabling APRNs and CRNAs to utilize their education and licensure fully, we can enhance veterans' healthcare access. This becomes particularly advantageous in regions facing a deficit of physicians, as it can help bridge the gap and provide necessary healthcare services. It would also be a more efficient use of resources since APRNs and CRNAs possess advanced healthcare skills and can deliver high quality care, including primary care and anesthesia services. Maximizing their abilities can effectively optimize resource allocation within the Veterans Health Administration system. It would additionally be a cost-effective solution because broadening the range of responsibilities for APRNs and CRNAs can generate cost savings for the VHA, given their typically lower salary expectations than physicians. This has the dual benefit of easing financial pressures and enhancing the effectiveness of healthcare provision. Care provided by CRNAs is also equivalent to physician anesthesiologists. There's no evidence of differences in patient mortality with care provided by CRNAs compared with MDAs. Weaknesses of our plan are that there will be resistance from physician groups. Physician organizations may raise objections contending that the expansion of APRN's scope of practice undermines the importance of physicians and jeopardizes patient safety. Overcoming this opposition and establishing collaborative partnerships between physicians and APRNs would present a challenge. Variability in APRN education and experience. While APRNs receive comprehensive education and training, there may be variations in their background and experiences. Ensuring standardized qualifications and competencies among APRNs and CRNAs is crucial to maintain high quality care across the VHA system. A shortage of CRNAs in the VHA system. Evidence shows that there is a shortage of anesthesia providers within the VHA, which can delay anesthesia-related care for veterans. However, allowing APRNs and CRNAs to practice independently will likely increase the amount of providers interested in working in the VHA and positively impact the patient outcomes. The plan also has multiple opportunities. Addressing healthcare worker shortages through expansion of APRN practice authority, the VHA can harness the capabilities of these healthcare professionals to alleviate workforce shortages, particularly in rural and underserved regions. This approach enables the provision of timely and accessible care to veterans who might otherwise encounter difficulties in accessing healthcare services. It enhances patient-centered care. APRNs and CRNAs often have a patient-centered approach to care, focusing on holistic and comprehensive healthcare. Expanding their practice authority can promote patient satisfaction and improve health outcomes by leveraging their expertise in delivering personalized and coordinated care. Patient satisfaction with provider care and positive health outcomes across care settings. Several studies demonstrate that APRNs consistently produce better outcomes in terms of patient follow-up, consultation time, satisfaction, and the provision of screening, evaluation, and counseling. APRNs in critical care settings and the operating room helped to decrease wait times, decrease length of stay, and therefore increase patient overall satisfaction.
Challenges to this plan include regulatory and legislative barriers. Revising regulation to encompass full practice authority for APRNs and CRNAs may necessitate modification at both the state and federal level. As a federal agency, the VHA's proposed rule would take precedence over state statutes that govern the scope of practice. This is aimed to establish uniformity across VA medical centers and reducing disparities caused by varying state regulations. However, despite this flexibility, the absence of a defined criteria in the proposed rule regarding sufficient training and appropriate privileges means that considerable variation in granting privileges would still exist as at the discretion of the local leadership based on specific requirements of each VA facility. Interprofessional collaboration could also be a challenge. Ensuring effective collaboration and communication between APRNs, CRNAs, physicians, and other healthcare providers is crucial for optimal patient care. Building trust, fostering teamwork, and establishing clear lines of communication may require ongoing effort and support. Modifying regulations regarding full authority of APRNs and CRNAs is complex, and the process takes time. The amount of time it would take to change legislation may discourage CRNAs from advocating for the change. However, by providing education and evidence to providers regarding full practice authority, there may be an increase in support for this change.
In summary, CRNAs have recently been excluded from the VA's handbook, which prevents them from practicing to their full extent of education and licensure. If APRNs/CRNAs are granted full practice authority, the VHA will greatly benefit in many ways. For example, they will have increased ability to healthcare services through surgical, obstetric, emergent, and pain management services. They can provide cost-effective care, and they provide care that is equivalent to a physician anesthesiologist. There are several weaknesses that could hinder CRNAs gaining full practice authority within the VHA, which should be addressed. These include resistance from physician groups, variability in education and experience of CRNAs, and a shortage of CRNAs in the VHA system. Challenges that may be encountered include regulatory and legislative barriers, the VHA's government of CRNAs/APRN's scope of practice within the VA system, interprofessional collaboration, and prolonged times to put change into action. With education, support, and an organized plan, CRNAs can enhance the VA system by practicing to their full extent of their education and licensure. This change will provide an opportunity to enhance the VHA by allowing CRNAs to deliver excellent patient-centered care, decrease workforce shortages, increase patient satisfaction, and increase positive patient outcomes for the VA system.